see the roof of his mouth and how it's divided into the hard palate and the soft palate. Be careful with your spelling. A lot of times people write plate and they leave out an A, and that's a easy mistake, so try to avoid that. So now we can see those two palates up here. So the hard one is going to have the ridges, and then the soft one just kind of has a muscular surface to it. And then behind the soft palate is the opening to the nasopharynx. So you can see that goes to the nasal cavity. And then on either side where the hard palate and the soft palate meet up, you've got the internal nares. And then this opening here would be the glottis, and that little flap is the epiglottis. And then of course that's the tongue. The salivary glands, the parotid salivary gland, would be located around the ear. Sometimes when they take skin off of the minks, it'll tear the parotid salivary gland with it. So if you don't have a parotid salivary gland, don't be surprised. The mandibular salivary gland, you can see part of this mandibular salivary gland right here. They're kind of compact and oval. Usually they're a lot easier to see because they tend to stay put and not rip away so easily. So those are kind of the main things to find in that oral cavity. And then for the thoracic cavity, most of your minks should have a hole in their chest already. So there's one here, and then this one up here is usually the one that's most like what most of you guys will have. This one's kind of accidental, looks like. So let's start up here so we're consistent. I usually will use it to figure out how thick the thoracic wall is, and just get my scissors under there and start to follow it slightly off center, okay, down his chest, and eventually you'll hit the top of his ribs and the sternum, and that's why we go off center, so we can avoid going right through the sternum. And you should just use your scissors for this. Most of these scissors should cut through the ribs no problem. Now if we look at this, I cut one layer of muscle, but there's still a layer of muscle right here, and that's where those ribs are. So the best way to get up under the ribs is to kind of push down right at the top, and you'll feel the top of his rib cage. And so you want to put the scissors right underneath that rib cage so that you're only cutting the ribs. What you don't want to do is just jab at it like this, okay? Don't do that. Go kind of sideways, so you're just cutting the ribs. And we're going to go all the way down to his diaphragm today. If you go too far, it's not a big deal. We're going to do the abdominal cavity next week, but right now we're just going basically to the end of his ribs. So you can usually feel approximately where the ribs end. And then when you get down there, you're going to go over to the sides. Sometimes when you get down near the diaphragm, it's going to want to hold on to that anterior thoracic wall, so you can just cut it away. But that's what that resistance is the diaphragm and the falciform ligament. So we'll see those more when we get to our abdominal cavity. So these are what I call lateral cuts, when you go over to the either side in the lateral direction. And this is going to allow us to open up that thoracic cavity, kind of like a jacket, okay, that would button down the front or zip down the front. Let's see, do you have any scissors? I might borrow yours. So now, see this membrane here? That's part of our mediastinum. It usually tears pretty easily. Okay, so typically we think of the mediastinum as a space, but there is this thin little membrane there. And then you can see the cut ends of the ribs, okay, right there. So those would be the intercostal muscles between those ribs. And if I kind of push them back up towards the top of the rib cage, they're going to get harder to separate. So I usually feel for that top rib and just very gently push it backwards. Just be careful because the edges can be sharp when they break like that, so you don't want to accidentally cut yourself on those broken ends. And so you just kind of gently fold them back like that. You can cut a little bit on either side at the top too and do more lateral cuts if you want to, if it makes it easier. Some of the things you'll see right away when you do this are the thymus. So this is the thymus right here. So you can see kind of how that's located in between the top lobes of the lungs. And then these really pretty kind of liver colored organs, those are the lobes of the lungs. So you've got 3 on either side plus an accessory, you've got 3 on the right side, 2 on the left, and then the accessory, which is under the heart. So the thymus is right there. There's the heart with the pericardium on it. And then here's my cranial lobe, middle lobe, okay, caudal lobe. And then over on the left, I've just got cranial and caudal. And then there's a little bit of fat where the thymus was. If I carefully take that off, I'll expose the cranial or superior vena cava. Okay. And I drew a couple diagrams on the board of the vasculature for your thoracic cavity. But the main thing to keep in mind is that your veins are always going to be towards the top. So those are the ones that are going to accidentally get cut. If you do, it's not a big deal at all. Just kind of be aware of those because they're delicate and they're more superficial. So they're more likely to get accidentally nicked or torn. And then under the veins, you'll find most of your arteries. So there's some connective tissue right here at the top of the heart. I want you guys to kind of focus on cleaning that out. Because one of the things that you'll need to find for checkout today are the azygos vein and the aorta, and both of those have to be sort of cleaned because they tend to be deeper underneath these organs. The azygos, the trick I like to do is pull everything to the left and look behind those lungs. And so if you scrape away some of that connective tissue, you'll see a blue vessel with a lot of branches. That's the azygos vein, and it kind of runs behind a lot of those thoracic organs. So you can kind of make out its blue shape or its blue coloration there. And then the aorta, same thing, except now you're going to go all the way over to the right and look behind those lungs. And so you're looking for something that wants to hold on to the heart, okay, because you're pulling on the heart, and so that aorta is going to hopefully be really easy to spot. If you don't see anything, take the probe, scrape away that connective tissue behind those organs, okay? The other vasculature stuff that you'll need to do is up here above the lungs. And so notice how there's like all these little, fibrous things. Just kind of scrape those gently with the probe, because since you don't have the ribs here, it's easy to accidentally damage stuff. The trachea is usually pretty easy to find, and on either side of the trachea you'll have a vascular bundle that consists of the common carotid arteries and the internal jugular veins. So hopefully you can see his trachea right there. Okay, it's kind of got the little C rings made of hyaline cartilage. And then on either side you'll be able to see your common carotid arteries and your internal jugulars. And then going out towards his arms, you would have the subclavian veins. Okay, and then going up the outsides of his neck, you would have the external jugular veins. All right, so that's kind of the things we're going to focus on today. If you don't get bone cutters right away, just work on the thoracic cavity until you can get some bone cutters for the oral cavity.